I will call the Richland County Community and Health Service Standing Committee to order. Today is Thursday, February 5th, and we will have roll call, please.
Miller.
Here.
Kramer.
Here.
Engel. Hendricks.
Here.
Perry. McGuire.
Here.
Harris.
Here.
Braithwaite.
Here.
And Checker.
Here.
We have 7 for our program.
Thank you. Verification of open meetings law compliance. Was it posted?
It was posted correctly for Thursday, February 5 of 2026.
Thank you. Okay. We have a 12-point agenda today. I need a motion to approve the agenda.
So approved.
Second?
I'll second. This is Cindy.
Thank you, Cindy. Okay. All those in favor, please say aye.
Aye.
All those opposed, please say nay. Okay, the agenda is approved. Has everyone had a chance to see the minutes from December 4th, 2025? Okay, I need a motion to approve the minutes from December 4th.
I'll go with that. I'll approve that.
Okay, thank you, Mary. And we need a second. Okay. Need a second, please?
Second.
Thank you. Minutes from December 4th, 2025 is. Oh, I'm sorry. All those in favor? All those opposed? Are approved. Anyone with public comment? Online or here with us? Hearing none, we'll move on to reports. We'll start with the HHS staff.
Alright. Super. Well, in your packets, we have our unit updates. So the manager sends in their updates every month. I guess just a few highlights in some of the programs. You'll probably see the ADRC is just winding down with helping with open enrollment. A lot of questions this year about all the Advantage Plan changes. They are going to continue the Rise and Dine at the Phoenix Center because it was so successful. So you'll see that starting back up here in February. Transportation program, over 4,000 one-way trips in 2025. Something new that is getting started in March is called a men's shed. It's going to be in the community of Lloyd. The goal of this men's shed is to bring men together over the age of 60, promote socialization, reduce loneliness. They're going to bring in guest speakers, have lunch. So they're excited about that new program. In behavioral health, just a steady stream of residents from in need of services, mental health, AODA. Our CCS and all our children's programs continue to grow. We are currently recruiting for an additional case manager due to a vacancy last fall. For the 2026 budget, we added a lead case manager. So we did fill that with an internal candidate. So that person started off a couple weeks ago. Their primary focus is going to be on training. The outpatient clinic, we continue to look for a full-time mental health therapist. But in the meantime, we're lucky enough to have a student come in and it's going to help us out for a little bit. And then when that student's done with their hours, then we'll have another student later this summer. So glad we can help out individuals because we do need therapists in the community.
Yep.
So. And the new behavioral health manager, she's unable to be here today. She's wearing multiple hats today. She's the APS worker and crisis worker today, Adult Protective Services. So she's busy with those programs. She kind of got thrown into the deep end with those, but she's doing a great job. Really proud of what she's been able to manage in the first couple of months here. It's been a whirlwind. Child and Youth Services, they continue to see a steady influx of reports, most specifically in youth justice, which timing couldn't have been better for Casey Baker to come back because that's her wheelhouse is youth justice, so we really need her. And in 2026, we also added that lead worker position. We replaced the supervisor with a lead worker, so we've appointed somebody internally as well for that. and they'll start in that role on March 2nd. Economic support numbers, you'll see all the numbers of phone calls, all the casework that they do. They're exceeding benchmarks, which is exciting. There was a scare in the news about childcare funding being cut, but it was not for Wisconsin. Of course, DCF is continuing to kind of keep an eye on that, though, because you just never know. What we are really trying to get the word out on now and really trying to advocate with legislature right now is for the federal reimbursement for food share. We used to get 50-50 match, right? So for every every dollar spent, we get 50 cents back in a federal share. In October, they cut that to 75-25. So starting in October, for every dollar we spend, we're only gonna get 25 cents back. So there is an ask with the legislature right now to fill that gap of that 25%, right? But it's kind of just sitting out there. They haven't brought it to the floor yet. We're getting a little anxious about that. Just an example of the impact of that money is we did not fill an economic support specialist position in our 2026 budget because of that cut. And then what ends up happening is then the workload on everybody else, it just becomes, the workload just gets harder and harder to manage when you have fewer staff. And then that in turn impacts what are called the food share error rates, right? So fewer staff, more workload, errors are made, things like that. So there's also an ask for money to bring on some quality control staff because federal government has penalties applied if your error rate's too high. So we don't want to. Wisconsin right now is okay, but if we ever go over that, it's 6% error rate. I can imagine it would trickle down at some point to the counties to have to make some of that up. So yeah, so advocacy with legislatures going on right now to get that brought to the floor before this session ends. Public health, they have a radon awareness campaign going on right now. Tests are available at our front desk. You can come in for that. They're also ramping up to start to doing some tick bite prevention. We actually got a grant specifically for that, so that's exciting. We're going to do some cool things with that. And they also have they're doing starting planning for a campaign on reducing adolescent anxiety. So that's what's going on there. And of course, community reports with regards to respiratory illness prevalent this time of year, as we all know. A thing that in there too is right now they have Grace Joseph. I'm probably pronouncing it wrong. But she's a public health intern. I think she is a student at Winona State University from Richland, from the community though. So she's back here for the semester getting her hours, helping us out with some of our data analysis, and her wheelhouse is epidemiology. So she's excited to be here and work with us on that. Some things not necessarily in the report. In February, there's going to be some meetings, meeting of the minds, if you will, think tank, going to try to put our heads together regarding homelessness in the community. I think everybody knows that that's a concern right now. So there's going to be some meetings happening with state people. We're going to try and get a local stakeholder meeting planned. So I will definitely bring back more information, things that we come up with. Probably have to bring some things through this committee if we do. I know a while back, Mr. Engel had asked about new mental health urgent care clinic at Gunderson Lutheran. Just wanted to look back on that. I haven't found any information on it yet, but I haven't forgotten about it. I did see a presentation where there is some a movement to draw down some funding to get more facilities like that, and some that are specifically suited for crisis urgent care. It'd be exciting if we could start getting some more of those. On the downside in that world, we no longer have a detox facility in the area. So that just is going to put more burden on emergency rooms and things like that. And people have to stay there longer. And just a couple of quick admin updates. We filled a vacant secretary position that had been vacant probably since October, I think, right? So we're excited about that. Our main front desk now has 2 people at it, which is great. We like that depth there. But at the same token, we had a retirement announcement of one of our fiscal specialists, so never a dull moment. But I'm a little excited for the person retiree, so. So that's all I had. Any questions about anything?
I know yesterday at the ADRC, I'm not part of the committee anymore, but they did talk about the homeless. And we talked about warming shelters, especially when it got so cold there. And they had them in the Richland Observer here in town where they could go. But the problem is, where do they go? Because these places close at 4:30, 5 o'clock. And that's when it gets bitterly, bitterly cold. And so that's something that concerns me, is where do they go at night? And right now, I think there was 11 that they counted.
I think Roxanne said 11 at
11.
one point. I'm hoping that, I can spend some time looking at like our emergency management shelter plan, seeing if that's something that we can, implement in those kinds of situations in the future. But yeah, put some planning in place, try and figure out a way to get things set aside. I think the biggest thing I have to think about is, the staffing of that. So we just have to be thoughtful of how we staff that. I think would be one of our challenges. But again, hopefully these work groups or stakeholder meetings will come up with some sort of grand plan, because yeah, definitely the overnight was yeah.
Yep.
Yep.
And I guess maybe one had children. So, it's just a bad situation.
Yeah. So
It's nice that they open these places up during the day, but the nighttime, once that sun goes down, and we had that wind chill, and it was minus 24, 35 degrees out there. It's pretty chilly.
Yeah. So
Okay. Health and Human Services expenditures.
So this part of the report just summarizes the vouchers that were approved in December of 2025, specifically those between $2,000 and $10,000 as required for board reporting. In total, there was 103 vouchers approved, representing $39,540.58 in expenditures. In all vouchers shown were reviewed, approved, and processed in accordance to county fiscal policies. Does anyone have any questions?
How'd you do for budget for 2025? Are we going?
yeah, that'll be next.
That sounds
That's next.
You want me to just jump in?
Yep, go ahead.
All right, excellent. So, transitioning into the 2025 Health and Human Services budget summary, that just provides a snapshot of where we are fiscally at year end. So as of the end of December, the department is at approximately 99% utilization for the board approved budget, with actual expenditures of $8.77 million against an $8.87 million budget. Most program areas tracked within expected ranges, with natural variation, of course, based on service demand and timing. Most program, after accounting for revenues, anticipated costs, and chargebacks, including the Mental Health Institute activity, the department is projecting a positive core budget balance of approximately $418,000. Overall, the budget remains stable and well managed, with no immediate structural concerns at this time. Any questions, or should we segue into the placement report?
Go ahead.
Sure. All right, so the final piece of the county placement report, which provides detail on both adult and child placements. We had Fund 54 utilized approximately 53% of its $705,000 budget, leaving a remaining balance of $329,000. And that's for adult placements. So for child placements, Fund 4 is approximately at 49% utilization, with the remaining balance of $348,000. So costs in this area are similarly driven by placement type, which includes institutional care, detention, and group treatment for foster care, and can change quickly based on support enrollment and safety needs. So overall, at this point in the year, both of these funds are tracking appropriately, and well placements remain one of our most unpredictable cost drivers. Current utilization does not indicate the need for any corrective action. So that's where we landed.
You say you have no control.
Right.
Uh,
That is definitely not something that we have a whole lot of control over.
No, none, really.
Get right.
Anybody have questions or statements or comments?
Nope.
Okay. Everybody okay online?
I'm Yep. okay.
Yeah, okay. We're moving on to Pine Valley Community Village. Brittany has joined us today. You're on camera.
I am.
How you feeling?
Better. I am feeling better. Um, for the administrator report, for the month of December, we were averaging 67 on the skilled side and 16. That has gone up for the month of January. Admissions for December was 8. Discharges were 6 for rehab purposes. We had a lot of hospital stays in December due to respiratory. So COVID and influenza being in the building. We went back into outbreak mode last week, thanks to yours truly. We did have survey come out last month. We had a complaint about over medication of a resident in-house. State did not find that to be the case, but they did see that we were missing one narcotic sheet. So in the event of that, we did get a small citation. It was a D level. It's F755 pharmacy services, procedures, records. So while we had every single other sheet for this patient, we were missing the month of December's. But it was not reported to myself or Jesse, which means we had it. And we wonder if it got sent back to the pharmacy along with the cards when they're used up. Unfortunately, by an agency person, which, we make mistakes. So we already are, POC's already been accepted. All the supporting documents have been sent. So we should be going into compliance. They accepted it yesterday in compliance as of the 29th. QAPI, we created a plan this last time about root cause analysis. So essentially falls, unwitnessed falls, just finding that root cause and having a good root cause for that. That's kind of been a challenge. People are utilizing alarms as a root cause, and that's just not something that we can use. So we're working on that. Staffing updates, we sent 6 CNAs to school, so a lot of them will be taking almost all of our open vacancies for CNAs. We're super excited. They're supposed to finish their course at the end of the month. So then we have quite a few full-time staff members coming on. Maintenance, we're still doing our drills. We do QA rounds. We complete those each month. We did notice on 4 and 500 wing, the spa door, like our actual spa bathtub, quit working. So we are trying to find a part, but it sounds like they no longer make that model. So we may be looking at repurchasing the spa tub. Dining and nutrition, we are implementing ITSE, which is the International Dysphagia, and the national standard is what is, because right now we are using the National Dysphagia something NDD diets, but we have to get to ITSE because it is the only recognized diet in healthcare at this time. So we're working those out. We have training happening in the next couple weeks with our speech therapist as well as our dietary staff as well as CNAs. So everybody's going to be compliant with knowing what diets look like, the verbiage of it, because the verbiage will change. Letters were sent out to families and physicians. So that should be a smooth transition. Let's see here. Technology, working with MIS about updating some of our technology like our computers and stuff, but we are looking into transitioning our EMR to PCC. We're just struggling with the lack of our systems being able to do things. So a lot of our stuff is still being done on paper, which the goal of an EMR is to remove paper from the building. So there's less places for things to get misplaced. But that is going to be something very slow as we're looking into those things. We did have resident council. We still have complaints with food, but we are getting a lot better. Kathy, she was out on an FMLA leave and she just came back. So she's actually doing a complete retraining with all of our staff. We've been hearing good things, but it is a slow process. So that's where we are at.
Anybody have any questions for Brittany?
I'd like to ask Brittany, there's two things there. You said there was a door that needed to be replaced. Is that something the county board will have to approve, or is this under your jurisdiction down there at on the Pine Valley budget?
This will be
And
under
why-
Pine Valley.
Okay, and why the problem with food? Didn't we just work that out with?
Yeah,
a
we
new
have a lot
company?
of new staff, unfortunately, in the dietary department. A lot of them are actually coming back, some of our old staff. So we have, I think, 3 or 4 people that were previously with us that are coming back. One retired for, reasons, but realized wants to come back. And like I said, it's a lot of new staff, a lot of younger staff. So they're not quite familiar with dietary department. So it's not the food that's the issue, it's the people preparing it. So it's just we need to get some retraining going and
All right. Thanks, Brittany.
Mhm.
Any other questions for Brittany? Thanks, Brittany.
Yeah, no problem.
Child support.
All right. So my report is for the last quarter of the year, October through December. For our performance measures for paternity establishment, we ended the year at 96.28%, so we exceeded our benchmark of 90. Court order establishment, 93.5%, we exceeded the benchmark of 80%. Collection of current child support, we ended the year at 74.72, so we did not meet that benchmark. But this has been a struggle statewide. We discuss it in our director and leadership meetings, trying to figure out like what's the best path to move forward. The statewide average at the end of the year was 72.91%. So we exceeded the statewide average. There was only actually a handful of counties that were able to meet the benchmark this year. That's how huge of a struggle it was for agencies across the state. And then our arrears collection, that is our performance measure that resets on October 1st of every year. It goes back to 0. So as of December 31st, we were at 60.26%, which I'm really happy with. We started off the first quarter of our fiscal year with a bang. So as of December 31st, our agency has 754 active child support cases. And at the end of our federal fiscal year, which ends on September 30th, our agency collected $1.13 million in child support. For staff and training, our part-time clerical position, our clerical assistant position is still vacant. Late fall, I had it posted. We had some applicants, but it produced a very small pool of candidates to interview. The interviews were not successful. So after having discussions with Tricia, we decided to put it on hold until this year. And now that the new HR director has been hired, once she gets on board and acclimated, I'll set up a meeting to meet with her to discuss this position so that we can get it reposted and see if maybe we could tweak the job advertisement, something to maybe get a little bit better applicant pool this time. Charlene and I, we continue anytime there's training that comes out, new training, continuing education training, we're signing up, we're taking it. And then As a director, you're required, when you become a new director, to take 2 years of new director training. So I started my second year of that, which is great because your first year, you're kind of like, what is happening? And now this year, the puzzle pieces have clicked into place and everything makes a little more sense. So budget reports are as of December 31st. As of December 31st, we still had 7.86 of our expenditure budget remaining. There are a few straggler invoices from 2025 still coming in, so that amount will decrease slightly. And then I just wanted to point out in our budget, there were a couple line items that we did go over, postage and office supplies. As we know, the post office just decided throughout the year to randomly increase postage rates. We can't foresee that when we're doing our budget. Office supplies as well, the cost of office supplies over the past year went up exponentially. I mean, just for a toner cartridge, I can't believe how much we were spending. And then probably the line item that we went over the most in was our new equipment. That is because my laptop decided to stop working, and so they had to purchase me a new one. But we did have enough money in between that line item and some of our other tech line items to cover that cost. But that specific line item does show in the red. As of December 31st, we received over 108% of our projected revenue from state and federal reimbursements. So we've received over. We also received a performance payment of over $11,000. January, I did our final claim for 2025, and we received that payment at the end of January. It is not on this budget report because it was received after this. But we did just receive a payment of $41,466 that'll be posted back to 25. So our revenue will actually end up being 139% of what we were projecting. So we're ending the year in the black. I'm extremely happy with that. And then the last piece is both houses of the Wisconsin State Legislature, they passed 2025 Senate Joint Resolution 34, which honors the 50th anniversary of the nationwide child support program. I'm not going to read this whole thing. I'm just going to pull a couple high points. So the federal child support program was created in 1975 when President Gerald Ford signed the Social Services Amendment of 1974 into law. The child support program in Wisconsin is administered by 71 counties, agencies, and 9 tribal agencies. Child support is one of the most effective anti-poverty programs in the nation, and it closes the poverty gap by an average of 44%. And then Wisconsin is actually one of the leaders in the child support program. We rank 3rd in the nation for collection and distribution. So, and that's all I have. If you guys have any questions.
This payment for performance that we got this year, is that, what exactly is that? And is that something we had before, or did we do something?
No, we get it every year. So these performance measures, if we meet them, so if we would have met all of our performance measures for the year, we estimated that we would have got a performance incentive, like, I think it was like around $32,000. Because we didn't meet all of our performance measures, then they prorate it out and we received $11,000. So, but our agency has consistently received every year that I've worked for them. I know previous years from me being here that we've received some types of performance incentive every year. And we do not budget for that money because we don't know how much we're gonna get. So it's just bonus money to put into our budget, so.
Anyone else? Anyone online? All right.
I had a question.
Yes, Dean.
Can you, I don't know if I missed it really in your report, but can you expand a little bit on your problems with the child collections?
So current child support is what they're ordered to pay per month. And we have a lot of best practices that we use. You know, we try to do outreach by phone, by letter. We'll have people come down after their court hearings and discuss with us. Some of the trends that I've been seeing is we have an increased number of people who, some people quit their jobs thinking that that will keep them from paying child support. It doesn't. We have an increased number of people who have fallen into either incarceration, substance abuse, homelessness. We try to monitor those cases to see if we should bring them back to court to modify them. We have cases that we have to send to other states. So, for example, I have a case where dad was ordered to pay a very large amount of child support. He took off to the state of Texas. I now had to send our case to the state of Texas and say, I need you to enforce this for me, and they can't find him. So,
It's a big state.
so the child support just keeps racking up, and we get dinged on it every month because there's no payments coming in on it.
I see.
But so there's a lot of different factors, and like I said, this is something we address. I have, every other month, we have leadership meetings with all the agencies in southern Wisconsin. We have quarterly, we have director meetings with all the directors of the agencies, and this is something we discuss every time. And agencies are all struggling with it. How do you get people to step up and take care of the kids and pay their child support? So, and so, I mean, a lot of it's just the economy right now.
So your problem is primarily the dysfunctional family, right? That's what creating most of the problems.
Somewhat, like if someone is employed, we can send paperwork to their employer and have their child support garnished out of a check. If they're self-employed, they have to pay it themselves. If they're unemployed, they still have, you know, they should be searching for a job and showing us that they're searching for a job, trying to obtain employment. So then they can get back on track with paying their child support. I mean, short of going out and turn them upside down and shaking them for loose change. I mean, again, like I said, we have constant discussions on how do we fix this issue. So.
Okay, thank you very much.
I think that's been an issue for a long time. People to pay their child support. Number 8, discussion and possible action, changing the committee meeting time. Let's start with you, Marie. Is there anything else like on the first Thursday of the month here in this room besides us in the morning?
I don't have access to my calendar down here. Off the top of my head, I would say no. But like with the ad hoc committees being added on, I'm not 100% sure.
Well, we were just going to discuss and maybe change the committee meeting time. Right now, I know we used to meet at 9, and then it was changed to 9:30. But I can't remember for sure, but usually, some meetings start at 10, and then there's others that start at 1 in the afternoon. So maybe for next, if it's all up to you, we can just keep this on the agenda, have you look at your calendar for next time and let us know that maybe this isn't even possible.
I will pull the calendar.
Thank you.
Consideration from it.
Well, we didn't know.
But are you looking for the same day or should I do?
Saying that this, keep it on the first Thursday, because everybody's used to that, but just changing the time that the meeting starts. Yes,
What seems to be the problem?
I'm the problem.
Oh, I'm sorry.
I'm the problem.
What were you thinking of going to?
I was thinking of maybe either 10 or 1 o'clock in the afternoon.
I have no problem with changing it to that, but I'm retired, so
Yeah, and then you ladies will have to look at your schedules too to see if that
Well,
would work.
For Health and Human Services, I actually have blocked off from like 9:30 to noon. Just because you just never know what might be on the agenda or what conversations might lead into a longer meeting.
And I
There's-
do the same thing. I just block off a couple hours because again, you don't know how long the meeting will last, so.
So if it moved to 10, that wouldn't be an issue. 1 o'clock, I mean, we have to rearrange. I mean, for me personally.
Well, I'll have Miranda pull the calendar, because like she said, we do have a lot of ad hoc committees that have been added to the schedules, so we'll keep that on for next time, and everybody kind of look at their stuff for either 10 or 1 o'clock. Let us know, come next month.
And Cindy, I can, sorry, Madam Chair, I can email you.
Sure.
I can send you an email of what's on. When I get back to the office.
Sure. Thank you, that'd be appreciated. All right, number 9, discussion and possible action, changes to the Pine Valley Community Village Addendum.
So we are changing the addendum to match the Richland County handbook, in regards to the exemption statuses as well as, the comp time. We did leave out a little bit of a change, and that's just, like Jesse, Mark, Roseanne, like our RN supervisors and people who can directly work with patients, or take a cart. We still want them to be compensated for that. So we will match. And then anybody who has that direct care patient ability, if they work the floor or the cart, then they have ability to earn for those hours worked.
Anyone have any questions about that? So we need to make a motion to approve this change then.
Yep, changing it to match the county handbook with a small change. And that's the ability to earn their salary wage when they work the floor.
And this will also go in front of the county board.
Correct.
Okay, so do we have a motion to approve this to move on to the county board? Dan, you have a question?
Well, as you may be aware, I missed about every other word, but,
Oh, I'm sorry.
if I'm gonna vote on something here, I need to know, I need more clarity. Just exactly what are we voting for?
So because Richland County made changes to their handbook, our handbook is different. So we also have to make those changes as well. So you guys approved or was a part of the approval for the Richland County handbook to change the exempt versus non-exempt statuses, as well as the comp earning time hour for hour. So those are the changes that are going in the handbook, with the exception that if our RN supervisors or DON or anybody who has the capability of actually taking a cart or direct patient care will be able to earn for those hours worked.
Are these over and above hours or of scheduled hours or?
Yep. So if they work like the weekends, all of our RN managers and DONs, they have to take an on-call weekend. If there's a call in on the weekend and they can't find coverage and they're required to come in, that gives them the ability to earn it for those hours coming in above and beyond. So if it's during the week and it's a day shift, no, they would not earn it because it is during their regular working hours. But if they were required to work the PM shift, anything above and beyond their required working hours would be able to earn it there additional.
So they don't get paid as much on call.
They do. So they get their salary, so they're exempt. But they get the capabilities if they work above and beyond working the cart, physically working with the patients, a direct care patient. They have the ability to earn above that. So currently right now they clock in as an RN2 and they would earn it as an hourly wage. Well, with the exemption status is changing, it takes that away, but we still didn't want to take that piece away of them being able to earn if they have no other options aside from working those shifts. So it's kind of like a bonus versus an hourly status.
Sam.
Yes, go ahead.
In the past, the problem is with that is, we felt now the numbers are even lower than it was when I worked there. If you're gonna be a manager and fill in on a weekend, it would be a more money saving to just have that individual take off a different day the following week rather than offering this, because it just, I just don't think I can agree with that because, just working there for many years, I know that there could just be a day taken off during the week if they end up having to come in on a weekend. Otherwise, it's just a money making more. Somebody's gonna be getting more money than they're actually, getting with their salary. So my feeling is if they do have to come in, then it should just be another day taken off during the week.
They don't work enough for, I mean, they work Monday through Friday, and a lot of them won't take that additional time off. They usually just come in, just because they have a lot of items and things to complete during the week. I'm more than happy to table this and get more feedback from our staff. But when Trish and I actually sat down and talked to the staff about the changes, they were not exactly overly excited about that.
Well, the other thing is when the schedule's put out ahead, if you already are in a position and you're, then they're getting scheduled ahead, knowing that they're gonna be working floor.
They're not scheduled on the floor ever. It's only in the
Talk
event
about-
of
Like the HR person, she's got. that
she's exempt from
position,
it.
And then she's working as a medical assistant or whatever, and that involves more.
But
money.
she doesn't fall under the wage scale. She remains non-exempt, so she does not fall into the category.
Okay.
So anybody that's 13 and below are considered non-exempt. Anything 13 and above is considered exempt. So the HR and our scheduler who have the capabilities of working those additional hours as well, they don't fall under that exemption status. It's just our RN supervisors and our DON and our MDS coordinator.
Okay, Brittany, could you tell me, you got your managers coming in on the weekend, but they don't work on the floor? Is that what you're telling me?
Correct. So they oversee the follow-ups, they oversee all the things they cover for the LPNs that are on the floor doing assessments, and they have to update the care plans, update orders. They have an office position. So on the weekends, their manager on call in the event that we have call-ins that we aren't able to. 90% of the time we're able to cover it, but there are those times where they're required to come in because we don't have that coverage. And that could be anywhere from AM shift, PM shift, or knock shift.
And that's for only direct caregivers. So for instance, if they come in on a weekend, I'm just trying to get this straight in my head too. If they're called to come in extra over a weekend, they're actually taking the place of a hands-on caregiver rather than their management position.
Correct. They're not doing anything in their management. So the reason LPNs and RNs that work the cart aren't able to be exempt and they have to be hourly is because their job provides direct care to the patients. With our RN supervisors, while majority of their job is in, an office position, they are able to provide that direct care to the patients, which is essentially, taking time away from being home. And that's where we came up with the fact that, we still want them to have that added benefit, but it's not like it's every weekend they're doing it. It's once every 6 weeks for one person or whatnot. So
Is this essentially budget neutral thing? I mean, the person that called in is not getting paid.
Correct.
So the person that takes their place is possibly getting paid a little bit more per hour. I don't know.
Correct. It's a little bit more, but it's less than bringing
Okay, two people.
agency. Yeah, so it's a little bit more than like our direct floor patients, our direct floor staff, but it's a lot less than agencies. So, I mean, it remains kind of neutral without having to pay the agency wages if they're, short of us just posting it on clipboard, or posting it with one of our other, agencies. It would be cheaper in the event to have one of our own staff come in.
How many agency nurses are you, do you have now?
It really depends on the week. It depends on the call-ins. It depends on, FMLA leaves. It really depends. I don't have an exact number in front of me. I haven't been in the building all week, unfortunately. So I get a weekly send out of how many agency we have. I just haven't gotten that. That usually comes out on Fridays from our scheduler of who we have for agency in the building.
Go ahead.
I think I'll just get back with you on this because in the past, like, for example, HR was a nurse and they, did both jobs back and forth. Right now, I think, we should address maybe the HR working like they used to and then picking up a weekend now and then, or, combining that rather than having it the way it is. We should look into that. So I'll just talk to you later on that because, yeah, it's just kind of overkill with some of the.
We can't change the exemption status on HR as they fall below that. So they do work the floor above and beyond, usually on the PM shift, so that they're able to do their job during the day.
Yeah, and I need to, I'll just talk to you
Okay,
later on.
sounds good.
Okay, so what's the wish of the committee? To table this until next month?
Yes.
Online, have any problems with waiting till next month to?
No, I don't have any
No.
problem with.
Brittany,
I
is
didn't
this gonna
either.
put you? Okay. Is this gonna put you, Brittany, in a position? I mean, do you have a deadline when this has to be?
I mean,
Yeah.
right now the goal was to follow the county handbook in general, with those exceptions. So, I mean, we can continue doing the things that we're doing as of right now and then tabling it till next month. I'm fine with that. So nothing unfortunately changes on our end to follow the Richland County handbook. So,
Okay, all right.
I would table it because we do have a new county HR person
Right.
coming in and I think she should probably have a chance to review some of this.
Dan?
Well, I don't think I feel comfortable voting on this in this subcommittee now, because, you're supposed to remain consistent with the county policy and the county handbook. And I don't have that information in front of me. So I would just either keep it for the full board or next month's subcommittee, that we can discuss it in more terms that way.
Well, like Elaine brought up too, we do have a new HR person on board and maybe she can compare the county's handbooks and Pine Valley and make suggestions too, along with Trish and Brittany, and then bring it back to us next month.
sounds
Who's the
good.
new HR?
I think it's Tracy Long.
Tracy
Okay.
Long.
Her name's Tracy Long.
Yes.
No one's told Tracy.
Okay. So I think most of the committee would feel more comfortable waiting until next month after we get some more information and we can do some reading ourselves and see. Okay. So I need a motion to put this on, wait till next
So
month.
we'll
Okay,
Sure.
okay, I'll second her Second.
All in favor, say aye.
Aye.
Hi.
All opposed? Okay. We'll wait till next month, Brittany.
Sounds good.
Okay. Number 10, did we have any correspondence?
Received any.
Okay, good. Number 11, future agenda items.
I guess we just talked about that, so.
Yeah, we'll have the Pine Valley Community Village addendum and also Miranda's gonna send me a calendar so we can talk about maybe changing the committee meeting time. And if we can't, we can't. So. Alrighty. And Dan, if you look at your packet on your iPad, Brittany has put in there her your handbook, I believe is attached. Yes. So at
Yeah,
least
the
you,
whole handbook is attached. Yep.
okay.
With the
Yeah,
proposed changes, under the compensatory time, it'll explain it too. Trish and I went over that, I can't remember what day it was, but she is familiar with those changes.
22 pages.
It's not that, it's not that bad.
Not bad.
It's just because there's healthcare, and obviously there are some differences that, we can't follow when it comes to the county, when it comes to healthcare, just because we are 24/7.
Okay.
So,
Thank you.
yep, no
All right.
problem.
I need a motion to adjourn.
I'll move.
Francis, do I hear a second?
I'll second.
Okay. All those in favor, please say aye.
Hi.
Aye.
All those opposed?
Nay.
Say nay. Then you may stay.
I like it here.
Yeah.
Madam Chair,
No, yes. All right, meeting is adjourned.
Get better, get better, Brittany.
Thank
Yes,
you.
Brittany, think about,
I'll be back Monday.
okay.
All right.